Fact or fiction? Winstrol affects the joints and creates painful joints. Hi, I'm Dr. Downey, and today we're going to dissect the research and see if this claim, which is commonly reported on forums, is in fact true. So I'll just be looking through papers and coming up to with conclusions on Winstrol. It will be referred to as Dinozolol in the research papers because that's its scientific name, and we'll just see if it indeed impacts the joints or could possibly impact the joints. So from what I found in the research, Winstrol does significantly stimulate this enzyme called Collagenase, especially in the skin fibroblasts. So Collagenase is a precursor to collagenase, which is an enzyme that breaks down collagen. And for those who don't know, collagen makes up helps make up different connective tissues, such as your tendons, joint surroundings, and your skin. So it does in fact seem to promote this destruction of the ECM or extracellular matrix, which in turn could reduce strength and thickness of this layer. Furthermore, it was found that Winstrol inhibited fibroblast growth factor, and fibroblasts are these cells that help produce collagen and are quite important in replacement of damaged tissues, or such as skin, and removal of skin that's constantly being removed. So it was found that in both the skin and synovial fibroblasts, and the synovium is found within the joints, that the fibroblast growth factor was inhibited, which means there is a lack of fibroblasts and fibroblast stimulation, leading to poor collagen synthesis and a decrease of that layer of connective tissue. So there was only one paper in which collagen synthesis seemed to increase with Winstrol, and it was found that it influenced transforming growth factor beta. However, this study is much older than the others, but again, the research on this is a bit limited. However, we know from clinical practice that Winstrol is in fact used for connective tissues, and in particular something like Dupuytren's contractures, where I'll display it. The pathophysiology isn't really known. However, it's thought that the skin thickens and that causes these contractures. The other theories include tendon thickening, and Winstrol tends to reduce this thickening and allow for more mobility. So in that case, it does appear that Winstrol could possibly create weaker joints through this breakdown of collagen, especially if there's breakdown of collagen in the tendons. That I would struggle to find, but it could be possible. But there could be a possible mechanism in which it causes the joint pain, especially if it stimulates this collagenase within the cartilage of the joint, making the cartilage decrease in size and thus causing more pain. However, in many studies, they actually injected Winstrol into the joint space. It was intra-articular, and it reduced this osteophyte formation, which is seen in osteoarthritis, and it promoted articular cartilage regeneration, and the articular cartilage is that found on within the joints. So whilst in theory it could make surrounding tissue around your joint weaker, that doesn't necessarily mean there will be joint pain, because joint weakness isn't joint pain. It just means you're at higher risk of injury, and individuals complain that their joints just feel dry / painful and craggy almost, I suppose. But it's the issue is this Winstrol. This effect isn't just specific to Winstrol. Testosterone has the same effect, and in fact, Winstrol administration is beneficial in reducing the pain experienced with osteoarthritis, which would mean it was protective of the joints. And in some cases, it reduces the stress of exercise within the joints and the muscles and the tendons. And this is through reducing reactive oxygen species, thus reducing oxidative stress upon these joints and muscle tissues. So the research so far doesn't seem, whilst it does show joint weakness, it doesn't necessarily mean joint pain. And the joint weakness is only theoretical if we assume that Winstrol stimulates this collagenase within the actual tendons, which hasn't been shown. It was only shown within the skin and the synovial fluid, synovial membrane, as we mentioned above. So let's look at long-term studies and see whether joint pain is reported as a side effect. And in this study it's used commonly in something called hereditary angioedema, which is just like swelling of the whole body essentially. And so they looked at the safety of long-term stanozolol therapy or Winstrol therapy, and in this case the patients had been using 0.5 to 2 milligrams daily for 20 to 40 years. Now, whilst this dose is much less than that used by bodybuilders, it's still used over a long period of time, which then side effects could accumulate, and isn't that much lower than, let's say, a 25 milligram daily dosage of Winstrol, which is commonly used by people starting Winstrol. And the only adverse side effects they could pick up on are those that you would expect with androgens, such as menstrual irregularities, postmenopausal bleeding, weight gain, mood changes, hirsutism, which is like facial hair growth on women. The liver enzymes did not seem to only be transiently raised, and there were no persistent abnormalities. The only thing is, which is well documented with Winstrol, is it elevates triglycerides and decreases high density lipoprotein or HDL, which is your good cholesterol. So what are other possibilities or mechanisms through which Winstrol could still possibly cause joint pain? And I'm guessing it might be due to the fact that it causes diuresis, which it is a mild diuretic, and which is why it's like to be used before a competition to give you that dry look. And when people tend to use Winstrol, they tend to be on a cut, which means they've lost a lot of water weight, and since it's a cutting agent, so they don't have that protective water weight of water retention around the joints, which would be protective, and that would make the joints dry per se. But that isn't necessarily due to Winstrol, it's due to them cutting. And the pain they mention in all of these anecdotal reports seems to be non-specific, and everyone has joint pains if they're lifting heavy. I have joint pain, but I have joint pain every now and then, and I attribute it to heavy lifting. It's just, I think it's just, there seems to be a cognitive acceptance or bias in which, oh, I'm using Winstrol and now I have joint pain, it must be the Winstrol, whereas it's not reported within the literature, especially in long-term studies, and it could cause joint weakness, which wouldn't lead to joint pain, just may lead to injury in the future if not careful. So again, I think this is a rather outdated side effect of Winstrol with not much scientific backing behind it, and I implore you to if you decide to use compounds, and rather not base what you do off anecdotal experience, and try your best to look at the research behind these compounds. Well, thank you for watching the video. I hope you enjoyed it. Please like, comment, subscribe, and I'll see you in the next one.